So before I even begin speaking, I would like to acknowledge the Algonquin-speaking peoples whose traditional territory I am presenting today, as well as express my respect and gratitude for permission to be on the unceded traditional territory of the Comox First Nation, where I completed my practicum and in fact now live. So, the Comox Valley Community Health Network. It is a brand new health network. I believe it's the newest on Vancouver Island. Others have talked today about what health networks do, so thank you, Anna and Christina, for saving me some time on this slide. So health networks address social determinants of health by building on strengths of the community. They focus on collaboration and integration of various sectors. As you can see here, participants include individuals and community groups, local governments, community agencies, and organizations. Being the newest health network, my role with the network was more focused on participating in getting the network started, rather than seeing some of those actions and outcomes that others have talked about today. So the structure of a network, in the center, we have the coordinating circle. Here, this is the leadership team. They make decisions on budgeting, communication strategies, and are a hub for the action teams. Action teams, which you can see around them, are teams of people who have either established collaborations, such as the Comox Valley Coalition to End Homelessness or the Early Years Collaborative in the Comox Valley. And the other action teams can be either formed by the coordinating circle or be community groups who approach the health network wanting to address a particular issue or task in the community. The network functions with the support of a facilitator who provides administrative support and guidance and follow-up. So it took me a while to figure out exactly how a network functions and exactly how its actions affect the community. So I had a really great opportunity to be part of an action team on seniors housing. It was initiated by the network facilitator. It brought together a range of stakeholders, all seen here, to discuss what seniors housing needs are in the Comox Valley, identify gaps, and then determine ways to address those gaps and issues in the community. As part of my role with this, I put together a brief overview of what is already known about seniors housing in the Valley. And as this project moves forward, they'll be looking at other ways to find information, share that in the community, and hopefully create less duplication of work and share the resources of time, information, and skills to the wider community. As I said, my role was in the early formation of the movement from the transitional team to the coordinating circle. So I completed a few projects as part of that. And we're going to speed right up to the case study here. I was writing a report on how the coordinating circle was actually recruited. So the network transitional team created a subcommittee to recruit members of the coordinating circle. And they decided to, instead of following more traditional recruitment and hiring procedures, start with a diversity and inclusion lens that was open to learning and innovation while connecting with others, collaborating and sharing their processes. So in order to write this report, the first thing I had to do was ground myself in these values, which you can see are directly linked with the values of our program, so that I was able to understand and determine whether or not they had made their outcomes met their original goals. To write my report, I ran a debrief with the selection team. I reviewed meeting minutes and other documents of the network to piece together how the selection process had taken place. And I also paid close attention to cultural safety and diversity, taking in a range of perspectives and ideas from a really diverse selection team, as well as the coordinating circle, who also had input on what the process had been for them. So the outcome of the selection process for the selection team, or the Comox Valley Community Health Network, was that they had a new way of thinking about the process of application and selection. And so it created a shift in how they approach recruiting members to the coordinating circle and the network in general in the future. For me, it gave me a really great opportunity to learn new skills in collaboration, and really brought home for me that collaboration is challenging, that it requires a lot of hard work and effort to really integrate different ideas and make sure that the preconceived notions are recognized, addressed, and as much as possible put aside. So the most important thing that I think came out of my work with the Comox Valley Community Health Network was that partnerships with people is key to any social change. Thank you very much to everyone who supported me in my practicum and in my studies.
Thank you very much, Isha. Any questions?
Over there.
Hi, Isha. Great job.
Thanks.
In hearing you talk about everything, it really sounds like you kind of did like an evaluation, like an evaluation. It seems similar to kind of the processes that we learned about. So I'm just curious if you used any kind of evaluation frameworks to guide your process, or you went about it because you knew how to do it.
Yes and no. So this wasn't a formal evaluation. It really started as the selection team recognizing that their process had been unique and had had its own challenges and strengths, and that they wanted to capture that for future use. And I think one of the key parts was that they wanted to capture how much work it had actually taken to challenge their own assumptions and biases and really think about what is diversity and what is inclusion and how do we create that in our spaces and in our organizations. And so initially, I was working off of a debrief that I held with this group of people. So we chatted about what their experience was, what its strengths and weaknesses, the opportunities and threats that it had gone through. And so in that way, I think it was evaluative. It was very reflective of what has their process been and what were the results of it. And there was some follow-up with surveys with applicants to try and understand what their perspective of it had been, whether or not they felt it had effectively brought in diversity into the group. But as far as, and so I did apply some ideas of evaluation, but I wouldn't by any means call it a formal evaluation. It was more like a 3-month ongoing discussion with a variety of people, which at the end of I had a few things to say about. It hasn't been formally published, and I'm not sure where they're at in terms of releasing that. At this time, it's an internal document. Yeah.
Perfect. Thank you very much. Thank you.